Victoria Falls, on the border between Zimbabwe and Zambia, draws thousands of tourists from around the world every year to gaze at its rapids and cataracts. Nearby, but a world away from the luxury hotels, lies Mundumuswana village. Grace Mukamutema is one of the elders here. At 73, she's seen generations of tourists come and go, and she's seen the rise of HIV in Zambia and its impact upon her village and her family.
Mukwangu wakafa 1999 mu 9 March. Mwisi w'abayabana. Ponya twakapa makwacha twensi pacha bacho kuti ndirera bazikulu. Ta kumundi gwatsa kunzamiwo takwe.
Grace took them in and together they fought to survive, growing maize and groundnuts and doing what they could to make money.
Asikuno kuli michero wetegwa mawi ino patu imukulya nji. Awo fawozya nkuni 5 pini nazo bilizabwa. Bonyo botu abupenga tu abupenga.
As the country's infection rate crept higher, many families were forced into a similar position. Grandmothers raising their grandchildren, or worse, orphaned children raising themselves. In 2003, in response to the HIV/AIDS pandemic, Zambia's Ministry of Community Development and Social Services introduced a pilot social cash transfer scheme in Galom. It was officially launched a year later and then extended to other districts with high levels of poverty. The transfers are regular and predictable payments of money to vulnerable households with the objective of addressing social risk and economic vulnerability and reducing the intergenerational transfer of poverty. A person's assets, capabilities, and agency shapes their own and future generations' well-being. Evidence shows that children born into poverty are more likely to be poor themselves due to the intergenerational transfer of poverty. They are more likely to be malnourished and lack education, limiting their future life chances and increasing their own risk of being poor. It can also limit the assistance they can provide the older generation. Social protection programs are an effective way of addressing this dynamic. In 2007, Grace's household was one of more than 1,000 in the Kazungula district selected to join the cash transfer scheme. She immediately put the money to good use, building 2 new shelters and buying school uniforms for the children. It's early morning in Mundumuswana village, but Lonica and Fellow, Grace's grandchildren, are already walking the 5 kilometers to Nandu Basic School. They make it as the bell rings.
Come all of you, come and make a line up here.
44 of the students here are beneficiaries of the cash grant scheme and would not be able to attend school without it. The principal, Nzala Michelo, is also the local PayPoint manager and has seen firsthand the impact of the grant upon his most poverty-stricken pupils.
In order for these children to come to school on a daily basis, they need food. So if these parents have got food at household level, it means even the children will be able to come to school. So it has greatly assisted in as far as food security is concerned and the coming of these children to school.
Every 2 months, Grace visits the Nandu school to collect her 1,500 kwacha. From there, it's a short walk to the nearby market, where she's able to stock up on basic foods, and then to the clinic. In recent weeks, her legs have begun to ache, and Fellow has a chest infection. Without the transfer, Grace would not be able to visit the clinic or pay for the medicines she and Fellow are prescribed. In fact, without the transfer, the family would struggle for food, for shelter, and for healthcare, and there would be no money for school either. The transfer means the family is able to survive and even thrive. Social protection programs like this one are being implemented in countries around the world as a response to poverty and vulnerability. They're an attempt by governments, aid agencies, and NGOs to increase investment in human capital and interrupt the intergenerational transfer of poverty. They give children an opportunity to grow into healthy, productive members of society. In 2010, a group of development partners led a research project on good practice in social protection. UNICEF, the Institute of Development Studies, and Irish Aid looked at cash transfer programs in Kenya and Zambia. Their aim was to explore evidence that social protection was working in some places, and where it was working, to identify common lessons learned, lessons that other countries could use to improve their own efforts. A growing body of evidence is emerging that demonstrates social protection programs' ability to interrupt the intergenerational transfer of poverty in a number of ways, such as enhancing school attendance, nutritional intake, and access to healthcare, and limiting children's involvement in harmful forms of child labor. One example of this evidence is a Kenyan cash transfer program that provides a social protection system to poor households with orphans and vulnerable children. The Department of Children's Services, with support from UNICEF and the World Bank, provides cash payouts to over 100,000 households every 2 months. Evidence on the impacts of this program includes increased food expenditure and dietary diversity, including a 15% increase in frequency of food consumption, reduced frequency of illness and improved consulting of appropriate sources of care when sick, and a 12% increase in the acquisition of birth certificates, essential for accessing other statutory rights. In Chiga, near Kisumu, community leaders are integrated into the targeting process. They have formed a local committee for orphaned and vulnerable children that monitors beneficiary families. Although the cash transfers are not conditional, committee members encourage parents and caregivers to send children to school and to take them to the health center when needed. The committee also visits local schools and health centers to monitor children's progress. Kevin Kiguya is a retired school principal and the elected chairman of Chiga's Local Orphans and Vulnerable Children Committee, or LOC. Today he visits Pamela Uhure, who has recently lost her husband to AIDS. Through the grant, she has been able to build a small house for her and her 5 children. She's also able to feed them and send her elder children to school. Kevin has seen the positive impact of the cash transfer program throughout the community.
We do appreciate that the little money they get, they are spending it positively, correctly, and we as the LOC members, we are on their neck. We don't let them relax, because once we see a child does not go to school, we come to the house. So-and-so did not go to school. What happened? So we want this money that the UNICEF is directing through us to these people to benefit them.
The committee meets weekly at the local health center to discuss progress and gives feedback to the District Department of Children's Services. Generally, that feedback is good. But social protection is a constantly evolving field. Implementers of such programs often possess the experience, knowledge, and expertise to enhance human capital investment and interrupt the intergenerational transfer of poverty. The challenge is to ensure that good practice and innovation are used to inform policy and programs. In both Kenya and Zambia, pilot programs are being scaled up to serve more people in need. To date, their overall experience shows that social protection cash transfers work best when governments are committed to their success and when local communities are able to participate fully. Specific lessons apply in several key areas. Spending time and resources into getting the design phase right saves time and money in the long term. Decisions over targeting, how to enroll and pay people are difficult questions that take time and money to get right. The pressure to move quickly towards implementation can compromise proper planning and training. Once implemented, learning should be a continual process. In Kenya, those working on the OVC program meet annually to review how the program can be improved.
Designing a cash transfer program really needs to emphasize issues of commitment, and issues of capacity. In this regard, we were able to get very significant technical support from UNICEF, and we had consultant who came, and through the design, working with us here in the department and in the ministry, and then getting on to pilot a little bit and coming back to look at it, we were able then to learn lessons and to change the design.
Collaboration is very important in the design process, simply because we have to bring everybody together in consensus. And this is, of course, designing a new system, a system that isn't building on existing health centres or schools and so on and so forth, but is really developing from scratch the basis of a social security system. So rather than expanding pilot schemes incrementally into being bigger pilot schemes and even bigger pilot schemes and eventually crashing by not having the implementation of modalities worked out. At this stage, we've now taken a decision that we need to invest in bigger implementation systems.
Community involvement keeps social protection programs transparent. When people help to plan social protection programs, they are more likely to be fair, unbiased, and valued by recipients. Local OVC committee members in Kenya are trusted local leaders who mentor and support enrolled households.
A huge component of the government program is that they train the community structures that are implementing the social cash transfer program. As you understand, the Zambia cash transfer program is managed by communities, basically. So they're trained before the program is taken to the community. So there's a clear understanding of what is expected of them, and they communicate this to the people and the people that are eligible for the program, for instance. And that has helped the communities to accept the program.
People themselves must feel that these programs that we are implementing, we are not imposing on them, but people feel that they are part and parcel of what is going on.
And extremely important also is to ensure that there would be sufficient communication that provides ownership, not just with the officers at the different levels, but with the community. So the collaboration would really be between government and the partners who are working with them, and the community where we get the beneficiaries.
Social protection is only sustainable when it is supported by national governments. Influencing is an important activity in securing this commitment. Influencing is increasingly seen as a critical activity in establishing, sustaining, and expanding social protection programs. Clear, coordinated messages about the benefits of social cash transfers can positively influence parliamentarians, government ministers, civil servants, and the media. In Zambia, influencing is not only an external activity of development partners, but instead is led by civil servants in the Department of Social Welfare trying to advocate social protection to other government colleagues, particularly those in the Ministry of Finance.
One of the things we use to influence is to provide capacity building and training for auxiliary government departments like Treasury, Ministry of Planning, other partners in the process of program development, so that it could be a buy-in for us, and that has worked a lot for us, especially when we started taking people from Treasury, from the Ministry of Planning, from IGAD for the training on social transfers in South Africa. The more we took them, the more we got funding, the more we got support, and the more we got the approvals done.
I think you need a lot of effort, especially at the beginning, because despite the research and demonstrated impact of cash transfers, it truly affecting livelihoods. Parliamentarians and economists and finance officers tend to be quite cynical, and if you don't spend sufficient time in just getting them to understand programs that you're seeking to get social protection that will cushion and be a safety net that then make these people become economically active, then you meet met a lot of resistance.
What we realized very early on as we were coming into the sector was that there was a gap in terms of who will speak independently to the government. So the media was brought on board. Basically, the first step that we took with them was an orientation program where we took them to a learning workshop and introduced them to the theories of social protection, but that wouldn't be enough in its own. So we took them out into the field to interact with the people that are benefiting from the program, to see the results for themselves.
And when people go to those households and to see those households and talk to the beneficiaries and realise how important this payment is in either the short, the medium or the long term in terms of improving the lives of people in that household, that's really the most effective.
Management information systems are used to register people, pay them, and then make sure they receive the transfer they're entitled to. Although management information systems may seem an expensive outlay in the beginning, they reduce leakage and mismanagement and make transfers predictable and reliable for beneficiaries, saving both money and lives.
A robust MIS system is important because, one, it offers the system a way of tracking information for the users, and it is important to install this at an early stage because it provides stakeholders with viable information that they may need in the long run.
The system supports all operational processes, and you realize social transfers processes are interlinked. If you look at targeting, if you look at enrollment, if you look at payments, if you look at updates, if you look at conditionalities, these are interlinked, and it collects a lot of social economic information about the family. It will collect information about education, information about employment, information about the housing characteristics, information about land, and all other additional information, even about education of the children, which is important as you are looking at the issues you want to work on. And a robust system will support you very well as you are even at the early stages where you are piloting, and so that using the pilot you'll be able to scale up to the required amount.
Good relationships between implementing ministries and cooperating development partners really matter. They support coordination and help foster trust and partnership. A strong ministry is vital if the program is to be owned and managed effectively by the government. Harmonization among developing partners can also ensure that government does not receive multiple or conflicting messages. In Zambia, the main cooperating partners even share an office to facilitate coordination and have identified a donor lead that represents a number of donors in discussions with government.
Collaboration in this program led to a lot of learning and work improvement through sharing, working together, changing processes, learning from other people, interacting. It has been one of the best advantages of this program because as we work together with all the collaborators, World Bank, UNICEF, DFID, government ministries and departments, and sometimes the communities, were able to attract funding continuously for the last 5-6 years.
So in our relationships, we have ensured that the kind of relationship we have with our cooperative partner is mutual. As a department, I think we are very hopeful that in the coming years, we'll be able to scale up the cash transfer scheme to many, many more districts. And we are also hoping that as we implement the scheme, I think we are getting the attention and confidence of other cooperating partners.
In Kenya, Zambia, and other places, experience shows that social protection programs can succeed with sufficient investment in program design, community participation, political commitment, real accountability, good information management, and supportive partnerships. Beyond the lessons learned to date, challenges remain, and countries with social protection programs need more structured opportunities to share their successes and missteps with each other. In some places, they also need to overcome instinctive biases that place cash transfers in a negative light, such as handouts for undeserving recipients. Expanding opportunities for sharing lessons learned around social protection can help increase the number of countries with successful cash transfer programs and contribute to the number of vulnerable families who are breaking the intergenerational transfer of poverty.
This thing has done a lot of improvement, be it shelter, education, health. In fact, it's doing it. We are happy.